Good morning, and welcome to our press briefing on COVID-19. Today, we'll receive a briefing and updates from our community leaders. And first, I'll ask you to join me in a moment of silence for the lives we've lost to COVID-19 and for the families they leave behind. Thank you. We will now hear updates, of course, from our community leaders today, and I will make note, I will be using a disinfectant today after and before each speaker comes up. It does not require it to be wiped down. It will be sprayed and then it then dissipates and disinfects. So we will get started today with we'll start with the mayor of the city of Albany, Mayor Bo Durham. Mr. Mayor.
Thank you, Chief. Today, my discussion is more academic than anything else. When the experts back in the spring were talking about reopening the economy, they mentioned 3 benchmarks that we should look at. One is the number of hospitalizations in a community. And the reason there is, of course, once you have a certain number of COVID patients, as we have learned in recent months, first, the hospital is limited in the services it can provide, and at a certain point, it gets to a level of stress, which, as we have approached on certain occasions, is a point where there are no more beds, or the hospital, for some reason, in the early days, we remember a shortage of ventilators, is unable to treat all of the patients who are coming into the hospital. Second benchmark is the number of infections per 100,000 population. Our mask ordinance comes into effect when we have over 100 per 100,000 population over a 2-week period. Now, if we go to the Department of Public Health website, and there's more information than anybody can digest in one sitting, but I would certainly recommend the website to you as a source for information. If you have any questions, Dougherty County's rate is listed as only 5,442 per 100,000 population. We know that number is exceedingly low because if we will remember, when Augusta University came down, it indicated that 22% of our population had the antibodies, which would indicate that at least 22% of our population has actually been infected. The reason is probably that, if you will recall, in March, we had very restricted testing because there was a shortage of available tests. And all the way into April, I think it was late April before we had universal testing, which is referred to as anyone that wants to be tested can be tested. Just for reference, these counties in southwest Georgia have a higher rate than is listed on the Department of Public Health website: Ben Hill, Brooks, Calhoun, Clay, Colquitt, Decatur, Early, Grady, Irwin, Lowndes, Miller, Mitchell, Randolph, Seminole, Stewart, Sumter, Terrell, Thomas, Tift, and Turner. The third benchmark is closely related to the first. To the second. That's the per 100,000 population, and that is the positivity rate. And basically what that is you take a 14-day period and you identify the percentage of the people who were tested during that 14-day period who were positive. And that's the first slide we have today. And I'm going back here. What we're going to do is it starts on July 6th. I think it should be on your screen at this point in time. The 3 categories, green would be under 5%. Between 5 and 10% is yellow. Over 10% is red. If you see the graph here on the screen, the first 2 weeks that are listed, that's July 6th and July 13th, you'll see our rate was over 10%. It remained over 10% except for 1 week into August, and that corresponds with, as you will recall, a spike we had in the summer months. Now, the numbers remained under 10%, and at certain weeks, as you see, in October, and that's interesting because it's going to lead up to the Thanksgiving holidays, we were actually in the green zone. And I think Dr. Ruiz stated at a press conference, if not a press conference, it was a task force meeting, that for several weeks, Dougherty County was actually doing much better than other counties in the state. What you see here is the Thanksgiving holidays, we were still under 7%. And as we've learned, approximately 2 weeks after an event is when you're going to expect to see a spike. And then on December 14th, we see the rate go over 13%. When it gets up to 15%, it's still in the red zone, but it's what they call crimson. And that is where it is almost beyond the capability of the community to contain the virus. You see that from 12/21 all the way until January 25th, we've remained above 15%. The good news is that here you see that we have a decline that began on January 11th. Not a significant decline, but we went from over 19% to 18%, and this last week we were down to 16%. Can we go to the next slide? The next slide just basically shows us the testing, the weekly results. The number of tests is going to somewhat correspond, that's in the blue, going to somewhat correspond to the spread of the virus, because we know that when more people are getting sick, more people are being exposed, and more people are going to be tested. The gray line is the number of positives, and you will see that the uptick corresponds with that first graph we have just seen. Can we see the next slide, please? The next slide here corresponds with the first slide, but it's a graph, and we see as of about December 7th, we see a straight incline which was related clearly to the Thanksgiving holidays, which continued. There was somewhat of a lull, and that picked up again after Christmas and New Year's. And hopefully we see on this graph that decline I was referring to earlier. The last graph, and I want to thank the IT department and the folks from Phoebe for getting us this information. The last graph is a census of the hospital. We've seen Phoebe's representatives provide that information to us, but again, what you see here is an uptick in July and August, which we remember that was the second wave, and then we see the gradual decline. We had the virus pretty much under control right before Thanksgiving, and what happened is what all the epidemiologists told us was going to happen. You see this direct spike, and it's going straight up. The good news is the census at the hospital, and this is important. We've heard time and time again from the physicians who speak to us that the hospital census is going to be about 2 weeks behind the testing. And that has something to do with the severity of the symptoms increasing, and also people being asymptomatic for a certain period. But be that as it may, the good news here, and we'll hear from Phoebe, is that this last week the census did not go up. It stayed at 108. It did not decline. But Mr. Austin, the CEO at Phoebe, mentioned models they had been looking at. He said that those models indicated there would be a flattening in late January. That's what you see, and hopefully a decline in February. So all that is just sort of a discussion, academic discussion, but I think it is enlightening to see here the numbers. You really can't argue with the numbers. We know these three benchmarks, which have been pretty well disregarded by everybody. I would commend the Dougherty County school system, because they have sort of been guided by these benchmarks. What we know is that to follow the 3 W's we've heard: wash your hands, watch your distance, and wear a mask. But thank you.
Thank you, Mr. Mayor, for your comments today. Next up, we'd like to bring up the Chairman of the Dougherty County Commission, Mr. Christopher Cohelis.
Thank you, Chief. Thank you, Mayor. I want to talk real briefly about a few statistical things first, and I've gotten a lot of questions about this, about the distinction between the statistical reports that we provide versus those that are provided by the Department of Public Health. And I think that that's really important, because what we're tracking here in the community are the total number of tests that are administered, as well as the percentage of people that are tested who have the virus. And that's an important distinction. And then if you go to the Georgia Department of Public Health website, where they literally have a county report, where they have, county by county, they go and they assess things a bit differently statistically. They assess it per 100,000 people, and they set an infection rate, or the number of people per 100,000 that have it. And then they color code the map of Georgia, each county, in the different colors that the mayor correctly identified. You have different shades of red, crimson, tan, all in between. And if you go there now, right now, you'll see that Dougherty County is doing very well in comparison to the rest of the state of Georgia. And that's a great thing. It's a good thing. And it's a product of a tremendous amount of hard work. It's also a product of the fact that we went through a tremendously trying, an incredibly trying March, April, and May of 2020. It's a product of the fact that we have a large number of people that have some degree of immunity. It's also because we've put in a lot of hard work. We've established the informational infrastructure that we need. We established social distancing. We established rules. We went into lockdown for a period of time, which no one enjoys. And we applied those things. And yet, we still, like other communities, have experienced the spikes that surround Thanksgiving and Christmas, and that's caused, obviously, a rise in the virus. But I'm very thankful that right now, where we're at, and I'm confident in saying this, as after we signaled this last week, we believe that we were starting to see a plateau. We are. We know that now. The rate that the mayor referred to, we're at 16% of the people that are being tested, and we're testing far more people than we were testing in March, April, and May of 2020. So about 16% of the people are being positive, whereas about 3 weeks ago it was about 19%. And that makes logical mathematical sense. We're farther away from these events, such as Thanksgiving and Christmas, where a large number of people got together and spread the virus. And also where we're at right now is very interesting and very important, because we have another train that has left the station. We have the infection rate that left the station after Thanksgiving and Christmas. And so we had the rise of that, and we see it plateauing. But we're also seeing a very sharp rise in the total number of vaccinations that are being deployed here in this community. And I have to tell you, I am so incredibly thankful for all of our medical staff, our Department of Public Health, and for our partners at Phoebe Putney Memorial Hospital. We have, as of today, vaccinated more than 10,000 people in this community. And I want to express, it's not just people from Dougherty County that are getting this. People from all over the state are getting vaccinated here in little old Albany, Daugherty County, Georgia. We literally are at the tip of the spear in providing a tremendous resource in the wake of an unprecedented pandemic to people across the state of Georgia. And that is phenomenal. I'm so thankful that we were able to position ourselves the way that we were, the way that we've been able to partner, the way that everyone has worked together, the way that we've been honest, the way that we've been transparent, the way that we've reported the numbers daily. And I'll tell you, the numbers that we have here, these Daugherty County 14-day reports, these are reports that are more specific than what you get at the state level, because we literally gather all of this information from all of our partners, the Department of Public Health, Phoebe Putney, all of our local providers. They report all that information in, and we have the City of Albany under the mayor's leadership and the city manager's leadership in collaboration with the county. They aggregate all of this information so that we literally know this and we can understand exactly where we are at. And I'm really thankful to see not only a plateau following the holidays, but the fact that we're seeing this large number of vaccinations that are coming into our community. And I want to really reiterate, this is an incredible asset. And I know a lot of people may have questions about the vaccine, but I'll say this: over 10,000 people have been vaccinated in this community. And I said this last week, I said the week before, I'm going to say it again this week. Every day, there's an EMT that gets up, puts on his shoes, goes over to Phoebe HealthWorks, and his job is to make sure that if anybody has an emergency allergic reaction to the administration of the vaccine, his job is to take care of them. And you know what? He hadn't had to do his job one day. He hadn't had to take care of one person that has had an allergic reaction. And that is an incredible thing for our community. I'm not saying that, and I'm not a medical expert, but there's some weight behind that. And at a time when, if we cast our minds back to March, April, and May, which were very dark times, they seemed apocalyptic. We didn't think that we had any hope. We were literally ordering an additional mobile morgue from GEMA because we didn't have enough room for all the people that passed away. For us to be at the forefront of this and not only doing well, not only taking care of ourselves, but we're also taking care of the folks around us, I think that's something to be incredibly proud of. Again, I want to remind everybody that Phoebe has a number that you can call, 229-312-1919, 229-312-1919. You call, if you meet the criteria, you can go ahead and set up your appointment. They'll set up the appointment for you to get the vaccination. Again, it's a two-part test. We're not yet at the place where we get the one shot, it's a two-part administration of the vaccination. We're not yet at a place where we're doing the one-shot vaccination. That's okay. We're thankful to have the tremendous number of resources that we have here in this community. Also, something that I've learned I think that's very important. There's the capability to be waitlisted, even if you don't meet the current criteria of Part 1A or 1B for being a medical provider or being in a long-term care facility or being over the age of 65. You can call and actually get put on a wait list, even if you don't meet those criteria, because what I understand happens is these are time-sensitive vaccinations. And if, once they open a bottle, they have a certain amount of time to administer that vaccination. And rather than let the vaccination go to waste, they can call someone that is on the wait list. And that's very important, because when you have a resource as important as a vaccination, you want to make sure that you squeeze every last drop into the veins of this community that has been through so much. And so I would challenge everyone, please take advantage of these resources. Make sure that we can heal ourselves first so that we can continue to help others around us. Thank you.
Thank you, Mr. Chairman, for your remarks today. Next, we'd like to move to hear from our representative from Phoebe Putnam Memorial Hospital. We're fortunate to have with us today Dr. Kathy Hudson, who is the Chief Medical Officer of Phoebe Putnam Memorial Hospital. Stand by just one moment, Dr. Hudson. Dr. Hudson.
Good morning. As you can see from our graph, we continue to have significant number of hospitalized patients in our communities. At this time, we have 130 COVID-19 hospitalized patients system-wide. That is 109 here in Albany. Our numbers have slightly increased with hospitalizations over the past week, so we don't really feel that we've reached that peak yet of hospitalizations. So we continue to have double digits of admissions, and luckily we have similar numbers of discharges, so our total number of patients here in Albany remains somewhat flat. But as it's already been said today, we see a 10 to 14 day lag in hospitalizations from the testing, so hopefully we can see something change in the next couple of weeks. It continues to be a very deadly illness, and I'm sorry to say system-wide, we've had 11 deaths over the past week. So again, strongly continue to support the 3 W's, wear a mask, wash your hands, and watch your distance. I do have good news though, our monoclonal antibody infusion is doing well. We administered infusion to our 100th patient this week. I may have mentioned last week that it's a FDA approved for emergency use for treatment of early COVID-19 infection. It does require a doctor's referral. So if you do test positive for COVID, do talk to your physician to see if you qualify, because it's only offered to a subset of patients with early COVID-19. The goal is to prevent hospitalizations and prevent increased severity of the illness. And I'm happy to report, many really report that significant improvement in their symptoms within just a couple of days. Our vaccination effort continues to go well. We have administered over 16,000 system-wide vaccinations since this began. Of our employees that have tested, received both vaccines, we can say that we have 99.9% effectiveness in preventing COVID-19 infections. So if you have not had your vaccine and you do qualify, I strongly encourage you to get that vaccine. It is safe, it is effective, and it will help overall. The state of Georgia still limits the vaccinations to healthcare workers, first responders, and individuals 65 years of age and older. So if you do qualify, again, the number for Phoebe is 229-312-1919. That's 229-312-1919 to get registered for your vaccine. We've had a tremendous response from outside our community for vaccinations, as our process seems to go very well. So this week we began to limit our vaccinations to Southwest Georgia residents. We want to ensure that our residents have an adequate supply of vaccines. Hopefully the state will continue to keep up with the need for our vaccinations and continue supplying, but we want to make sure that our residents receive the first doses and maintain our priority. So I believe that's all I have to share today. Thank you very much.
Thank you, Dr. Hudson. Great report today. We'd like to hear now from our Director of the Southwest Georgia Health District, Dr. Charles Ruiz, is here to provide a report from Public Health.
I would like to add to some of the good news that we've heard here today. It is true that throughout most of the state of Georgia, the numbers of new cases are going down, and that's certainly true in Dougherty County. We follow that every day, and over the last 2 to 3 weeks, we've noticed this steady trend where the numbers are going down. So that's encouraging. but by no means is it a time to celebrate. The number of new cases per day is still high. It's still a threat to everyone who is not immune to COVID-19. But it is reassuring, and it does give us hope, especially when you couple that with the knowledge that more and more people are getting vaccinated every day in Daugherty County and throughout the state. In fact, at the health department, we're vaccinating 5 to 6 days a week. Today, the Daugherty County Health Department will reach its mark of 2,000 patients vaccinated. The Daugherty County Health Department is also assisting in a small way, but a significant way, with the vaccines that are being provided through Phoebe. The health department is supplying several nurses a couple of days a week to go over and assist with that. It's a great service to Southwest Georgia, what's being done at the Phoebe Vaccine Clinic, and we're happy to partner with them. But public health currently is doing the vaccinations at the health department only. It's by appointment only. You drive up to the parking lot and you walk in and get the vaccine indoors. It is really easy to get the vaccine. You simply call the health department if you believe that you're eligible, or if you're not sure, you can call the health department at 229-638-6424. That's 638-6424 to schedule a vaccine appointment. And we have had lots of phone calls. We have hired extra operators to answer those calls, and we monitor the calls. And as of yesterday, the average wait was about 3 minutes. So for a free, life-saving intervention, 3 minutes is not too terribly long to wait, but we do appreciate you being patient when you call. Currently, we are still in the expanded 1A phase, which of course includes healthcare personnel, residents of long-term care facilities, law enforcement, firefighters, people who are 65 years of age and older, and caregivers of those who are 65 and older. We are using the Moderna vaccine through public health. That's the one where the 2 doses are generally separated by 28 days. If a person cannot get back to get their second dose in exactly 28 days, it's not a big deal. We always try for exactly 28 days, but if there's some circumstance that prolongs the interval between the 2 shots, if it's a week late or even 2 weeks late, it's not a terrible thing. We don't want people to be terribly anxious if they happen to be a little late on getting that second injection. We currently have not experienced any significant shortages of COVID-19 vaccine in Daugherty County. In fact, throughout public health in Southwest Georgia, we haven't had anyone that was turned away because of a shortage of vaccine through public health services. We hope that trend continues. It ultimately depends on how much the pharmaceutical industry can put out each day. We're confident they're doing all they can to produce the vaccine. But then it's distributed throughout the nation by decisions that are made by the federal government. When it comes to Georgia, then the leadership in the state of Georgia decides where the vaccine will go, county by county and provider by provider. So vaccines are available for those who are eligible. At some point in time, the eligibility criteria will be expanded. I do not know when that will be. We can speculate, but at this point, we don't know when the expansion will take place. I'd like to shift over and talk some about testing. Free testing for COVID-19 is readily available in Dougherty County. I mentioned last week that we have entered into a partnership with the Exchange Club Fairground and a business called Mako. You can go to the fairground 6 days a week, Monday through Saturday, and get a free COVID test. We strongly urge that you pre-register to get this test. It's not really an appointment. You're not assigned a particular time to show up. But if you will pre-register, it will streamline the process and make it quicker for you and the people who might be in line behind you. So for those who can see the graphics, we have this information summarized. The test, again, is done at the Exchange Club Fairgrounds on the corner of Oak Ridge and Westover, Monday through Saturday. And one really easy way to pre-register is by using the QR code. And I'm pleased to say that on this morning's edition of the Albany Herald, up in the right-hand corner, you can find the QR code, and it's easy to scan it, and it will take you to the Mako registration site. You can enter your information. It takes about 2 minutes to do that. This code should appear on the front page of the Herald for the next few days. So if you miss it today, you should be able to do it easily. Another way to get to this code is to go to the Southwest Georgia Public Health website on the internet, and you'll find this information there as well. And again, there's no cost. The turnaround time is about 36 hours for the test result. This is the standard PCR test. It's a good test. The positive results are reliable and the negative results are reliable. So just remember, we are still in this pandemic. People are still getting sick. People are still being hospitalized, and people are still losing their lives. We need to take it serious. We need to do what we can to maintain our own good health, to protect our families, our friends, and our community. Thank you very much.
Thank you, Dr. Ruiz, for your report this morning. We'd now like to get a report from our coroner, Mr. Michael Fowler. We'll ask you to come up and provide a report, please.
Woulda, coulda, shoulda. Woulda, coulda, shoulda. That's an expression that expresses of a disappointment. It stems from something. Someone could have done something, would have done something, and should have done something. I don't want a family member to say I woulda, shoulda, coulda. I wished I coulda. Practice social distance, wore masks. I wish they could have got the vaccine. I don't want a family member to be standing at the hospital and your loved one on a ventilator. You saying woulda, coulda, shoulda. I don't want your loved one to be standing at a grave saying woulda, coulda, shoulda. We should have paid attention. We should have took the advice. We should have follow the science. That's a statement that I don't want a family member to have to say. At this present time, yesterday I did a presentation. We was at 240. As of today, we at 246. So overnight, we had over 6 deaths that been proven to be residents of Dougherty County. We at 246. A few weeks ago, I was saying I hope we don't make it to 300, but it looked like we're on a racetrack to 300. In the last 8 days, we had 11 deaths. 11 deaths in the last 8 days. 31721, we have 35 deaths on the north side. 31707, we have 50 deaths. Southwest side, we have 100 deaths in Southwest Albany. 31701, we have 100 deaths. 31705 on the east side of Albany, we have 61 deaths. Going by race and ethnicity, Asian, we have 1 Asian, 3 Latino, 60 white, 182 blacks. We have 114 males, 132 females. On a breakdown on that, we have 1 Asian female, we have 1 Latino female, 2 Latino males, we have 64 white females, we have 26 white males, we have 86 black males, we have 96 black females. Going by age, you can look at the stacks, you can see where the middle range is age 60. So we have 2 over 100, and age of 90, we have 24. The age of 80, we have 56. Age of 70, we have 58. In the age of 60, we have 66. In the age of 50, we have 19. In the age of 40, we have 14. Age of 30, we have 5. And 20 and below, we have 2. This is significant right here, this frame. Again, March, we had 39 deaths. April, we had 86. May, we dropped down to 26. And you see we dropped down June 6, July 12. After the 4th of July, we went up to 15. September, we dropped down to 6 in October. November, we had 4 before Thanksgiving. After Thanksgiving, we went up to 14. After the New Year's, well, you can see it, after 14 in December, but you see we have 32 deaths in January already. We have passed May. May we had 26. We're on the road to trying to catch back up to March where we was at when we first started out. You gotta follow the guidelines. You gotta wear your mask over your nose and mouth. You gotta practice social distance with 6 feet. You gotta avoid the crowds. You gotta wash your hands. We've preached this since the beginning. You get ready to cough in your sleeve, in your cuff. Sanitize. You gotta sanitize. You have a gathering, what kind of gathering? You gotta sanitize the place. You gotta disinfect it. Monitor your health. I said it again. You start feeling bad, running a fever. As EMS said, Sam Allen said the other day, that you start feeling bad, you need to go get tested. Go to the ER or call EMS to your house. You need to do something. Don't say, well, it's going to go away. I'm going to try some of the old remedies. No, get tested because you may have the virus. Once those lungs are damaged, I don't think they ever recuperate back to normal. Once you've been on a ventilator, your health is never, I don't think, going to be the same. And majority of the time you get on the ventilator, outcome most times going to be negative. How to wear a mask. This is very important. Woulda, coulda, shoulda. I wish I'd wore a mask like they was been saying. You gotta wear it over your mouth and nose. The best way, as someone said, is a double mask. That's what I try to do, double mask now, or you can put layers of masks on. But you gotta do something. The wrong way to wear the mask is wearing it on your chin. This is not the way to wear a mask. Wearing it just on your mouth and your nose still exposed, when they get ready to test for the virus, what they do, they swab your nose, your nostrils. You inhale and exhale it. So your nose is being exposed, so you still can catch the virus with your mouth covered and your nose open, like this. Wearing it around your neck, what's the purpose of wearing a mask at all? Might as well take it off, because you still can easily catch this virus. We got to mask up. We got to follow the guidelines. I don't want to come to your house. I don't want to be able to hear a family say, I woulda, coulda, shoulda. Thank you.
Thank you, Mr. Fowler. As we move to the end of our press briefing today, we will pause for a moment for questions from our media. Yes.
Kathy, if you would be able to talk about the COVID-19 patients that you guys have now. Any symptoms, any different symptoms than you saw back in March?
body aches, low-grade fever. Some people have the high fever, cough, shortness of breath. So it really has a huge variation. So we can't say, oh, only if you have a fever could you have COVID. So it's a combination of all of it. Loss of taste, loss of sense of smell. We're seeing people, perhaps you know some people that have been tested positive and they didn't get tested till they lost their sense of smell. They didn't feel bad. They're the lucky ones. So there is no one symptom that I can say, oh, that's definitely COVID-19. Any other questions?
The people that are dying though, are they on ventilators or are they experiencing this extreme vomiting and nausea?
I can't say specifically how they presented. I'm afraid that the people that are dying are showing the severe illness and they have multi-organ failure. It doesn't just affect the lungs, it affects the kidneys, it affects the ability, the big people become what they call hypercoagulable. They have blood clots, even on anticoagulation medications. And so it affects the entire body. And so the people that die typically have the multi-organ failure. But there are some that are specific that their lungs, is strictly in their lungs, but again, it's that wide variation of presentations and illness. And I can't stress how, it's the use of the resources. I mean, we have to fight it. The only way to really get a handle of this is to prevent infection. Wearing the mask, washing your hands, keeping the distance, get the vaccine. If you do have symptoms, even mild symptoms, call your doctor. Get tested. There are treatments. We're using the monoclonal antibodies for people that are testing early for COVID if they meet the criteria. So get tested. Don't stay at home and go, oh, it's just a cold. I'll be fine tomorrow. I hate to say use those resources, but if you have, there's the options of the testing. Dr. Ruiz talked about there would be the drive-through testing. So please get tested. Okay? Thank you.
Thank you. Any additional questions? Let's pause one more time before we finish today to remind our citizens how important it is to get the vaccine. And we have the remind you of the COVID vaccine information that's available, COVID sites at Phoebe Putney Memorial Hospital, at Phoebe HealthWorks. Just call and make an appointment, Dougherty County Health Department, and Albany Area Primary Health Care. So these resources have been made available to our community. We encourage you to take advantage of these resources and take advantage of the information that we received this morning. I want to thank our community partners for being here. Thank you, media, for being a part of this morning so that we can share this message with our community. We'll see you here again next week, next Friday at 10 a.m. That concludes our press conference for today. Thank you.